Welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio. Did you know that the drug discovery industry hasn't accelerated its process in nearly 2 decades? Our guest is here to talk about a global health research network. Our guest is Chief Technology Officer, Mr. David Fusari. Welcome to the program.
Thanks for having me, Neal.
Now, I want to get into the topic, but I'd first like you to give me a little bit of background about yourself and talk about your role as Chief Technology Officer.
Yeah, sure. Again, thanks for having me here today. So my role here is as the Chief Technology Officer is I oversee sort of the foundational elements of everything that we do, from product engineering, product design, and a lot of our product delivery capabilities. I got engaged with TriNetX when it first was being founded as an idea that Novartis was kicking around to try to deal with complexities and the sort of the length and duration and of clinical trials becoming much more costly, and the old ways of doing things were just not very effective anymore. So my engagement back in 2013 was to establish the concepts and ideas that we have in place today. And my background of being around in healthcare for the past 22 years has been an asset in how one thinks about solving these problems relative to identifying patients for clinical trials, how one manages healthcare data securely, and how one deals with data privacy issues.
Talk about how you, more efficiently identify these patients and recruit them into these trials and studies.
Sure. The core issue that TriNetX was created around is this idea of trying to, again, expedite patients into clinical trials. If you look historically, back from sort of the late 90s, early 2000s to where we are today, you're seeing significant changes in the length of time that it takes to run a trial. So, for example, it used to take, about 450 days on average to run a trial, to now it's taking over 700 or 800 days to run a trial. The complexity and the criteria for identifying patients in a trial has gone up significantly, where for example, the number of procedures involved in a protocol would have been around 100, and now it's up to around 150 and 60 different procedures. So given this ongoing complexity in just trials and trial design, along with the ongoing risk and costs, where if you look at the total spend of trying to bring a new medication to market, about 66 or 2/3% of it is spent before you even get approval for your medication in the market, and even getting that approval is significantly risky, where you only have about the possibility of an FDA approval is only about 58% by the time you hit a phase 3 study. So given all those complexities, what we've done is we've tried to take a lot of ambiguity out of the process. Quite often, clinical trial protocols were designed based on just historical notions of diseases in the same therapeutic area. And what we've done is we've tried to create a much more targeted approach to how people design their trials and then how they identify patients. So, for example, what we've built is a federated network where organizations, healthcare organizations, pharmaceutical companies, and clinical research organizations can instantaneously run surveys of patients across all the healthcare organizations that are participating in our network. To date, we've engaged over 60 organizations and representation in 10 different countries for being able to access in a very secure and private and HIPAA compliant in the U.S. and privacy rule compliant in all other countries, so that data can be surveyed and trying to identify patients with those specific kinds of ailments. So, for example, if a pharmaceutical company may say they're engaging in a new trial for Alzheimer's disease, if they want to understand Alzheimer's patients, what kinds of medications those patients are on, how far the disease has progressed, they can instantaneously survey our entire network of millions and millions of patients to try to understand that particular patient cohort.
You're talking about the industry itself and all of the support industries when we're conducting these trials that have basically doubled in duration and in complexity. So hasn't that substantially increased the amount of documents that you're going to have to secure? You're talking about being HIPAA compliant. how do you navigate all of the different players in one's trial, managing the data and the participants?
Right. So our role, Neal, in this process is to I help organizations as they're designing their protocols before they've actually gone through their FDA approval process to ensure that patients like that even exist. Let me give you one example. There was one of our sponsors who was running a phase 3 trial, and we did a retrospective study on that particular trial because it had 15 amendments. And an amendment is basically saying you have to sort of go back and restructure some elements within the protocol. And in restructuring those elements, quite often you have to change the inclusion and exclusion criteria in terms of what kinds of patients you're looking for. In our retrospective analysis, we discovered that 5 of those amendments, by the way, each amendment has a cost of about $500,000 each and a loss of about 4 months of time lapse for each one, that we could have avoided them just by doing an analysis on do those kinds of patients exist or not. And by doing that up front, it's a huge savings just in time and energy to make sure you have the protocol well designed. The second phase is how do you then be able to connect to where those patients exist? Today in the industry, quite often you may get a general heat map to say patients like this tend to exist, in these major metropolitan areas. But we take a slightly different tack on that. What we do is we through our platform, there's ways for those sponsoring organizations to reach out to our healthcare members, so different hospitals, major hospital systems, academic medical centers. You can reach out to them through our platform, and the healthcare organization has a way to re-identify who those patients are within their organization, within their 4 walls in a very secure, private way, and then they can reach out to those very specific patients that were being analyzed during the protocol design process. We do not get ourselves engaged in the execution of a clinical trial. So once patients are recruited and you're tracking the information about that specific patient, that's outside our purview.
What about training to use your platform? Is it compatible across the board with the industry and the support industries?
Yeah, so training is pretty straightforward. So everything about our platform is accessible through a browser. So when a new pharmaceutical company or a new clinical research organization decides to join and use our platform, basically all they need is access to a browser. So we do give them training and guidance on how to use the tools and the capabilities, but we are talking, a matter of a few days at best. It is a SaaS-based platform where once you get access to it, they manage who their users are, they manage their user accounts, and then they control, the internal usage of the service and the software.
Now, as I pointed out, it's been nearly 20 years that this industry has kind of been stagnated as far as the process of recruitment and retention on these trials. Where do you see the industry in, say, 5 years based on TriNetX interjecting more efficiency into the process? Yeah,
well, I'll give you a couple of different examples to that, which I think will give you an indication of where I think things are trending. So recently, a healthcare organization joined our network, and different hospitals and different healthcare delivery organizations join our network for the purposes of wanting to gain access to clinical trials in which they think that they're going to be a good fit to host that trial. In the 5 months since they went live, they've already had 40 trial requests for patients that they would likely have a good fit for that trial. So what we're going to see going forward is exactly that, where there's opportunities to directly connect with those healthcare delivery organizations and partners to say, we have a possible approach to treating your patients, whether those are oncology patients, childhood-related diseases, what have you, and being able to reach out and connect to the physicians who work with those patients directly. I think 5 years from now, you'll start to even broaden that opportunity for other ongoing research capabilities where, it could be, patients reaching out directly to identify themselves as being a potential candidate for a trial. The information quality, though, coming from a patient directly is always a little bit lower, which is why we haven't focused on that approach to start, but over time we think that that's an opportunity that will start to present itself.
Where can we go and get more information about TriNetX?
Yeah, it's an interesting name, but it's spelled, you can go to www.TriNetX.com.
Appreciate you coming in and talking with us on this Health Supplier segment on Health Professional Radio. Mr. David Fusari, hoping you'll come back and give us some updates as things progress.
Happy to. Thanks for having me, Neal.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au. Also at hpr.fm. Subscribe to the podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm.